Hello everyone, Kitty Clinical here with a follow-up video from Step 1 Thoughts General Principles Part 1. This is going to be Part 2. I want to talk about some basic concepts about test-taking strategy that I think you should know about when you're approaching USMLE Step 1 questions. Whether this is question bank that you're using, UWorld, what have you, I want you to start thinking about putting yourself in the mind and shoes of the test taker. This is very important because when you're answering a question as a medical student or a test taker, being the one answering the question, it really puts things in perspective when you think from the perspective of the test taker, because that way you're not just saying to yourself, oh, I'm just going to guess. I have no idea what this is. I don't know what the answer is. If you put yourself in the shoes of the test taker or the test maker, right? The test maker has their own agenda. They have a reason for doing things. There's a reason why the question is the way that it is. They're not just simply testing you on, I don't know, some random concept that has nothing to do with medicine. No, they took something from your book, from first aid, from whatever flashcards you've been using. They take a concept from there and they turn it into a question, and they'll try to convolute it in such a way that you will have no idea how to answer the question. But if you think, okay, well, maybe the concept that they're asking me is this thing from, page 374 that I read 2 days ago. I mean, that's not going to be like that specifically, right? You're going to, obviously, you're not going to memorize the page numbers. But it's true. You're gonna have basic concepts that the test writer is going to test you on. They're not going to test you on some random factoid, the 0.0001% chance that this happens. Only one case out of the last 100 years has been like this. No, they're going to want to test you on high yield concepts, right? So diabetes is a great example, right? Diabetes, they're going to test, you can guarantee that you're going to see a question on diabetes. And when you see a question on diabetes, you should ask yourself, what is the concept that the test maker is trying to get at? They're trying to send you a message. They're trying to tell you something with the question. There's it's kind of like reading a story. There's a take home message, right? There's a moral to a story. Well, there's a moral to a question stem as well. They're trying to tell you something in that stem. And if you can put yourself in the shoes of the test maker, it will go very far for you. You will go very, very far. You'll get a lot of questions right because you are thinking from the point of view of the test writer. Some people, when they approach questions, they also like to look at the last question, like the question itself, and then they go back to the beginning of the question stem and they read all over. I'll tell you what, I actually did that too when I was answering questions. I would just skip to the question. Sorry, that's a cat. I skip to the question, and if I can answer the question without having to read the first 9 sentences of the paragraph, why read the first 9 sentences of the paragraph when I can just save time and just answer the question? If it's a simple, you either know it or you don't, what is the substrate, what is the enzyme, what is the medicine that uses to treat for this, whatever, that will save you time if you can just figure that out. But if it makes you feel comfortable and you want to read the entire question because you feel like there's a hint in the question stem, then by all means. I will say that they rarely ever put things in the question stem that have nothing to do with the question itself. So if they are asking you a question that's like you either know it or you don't, well, you got to ask yourself, okay, well, maybe there's something in the question stem that has something to do with it. They might not tell you the answer, right? But they will have something to do with the question. It'll be something related to the topic that's at hand. Yeah, very rarely will they give you a case presentation of a patient and tell you randomly on Saturday that they went skiing, and that had nothing to do with the question. I'm sure if they went out and traveled somewhere to an endemic area, that might have something to do with their diarrhea, right? But for all that it's worth, I would say that you should focus on what's important, and it should be easy to know what's not important. Sometimes they do give you things that are irrelevant, but the reason why they're doing that is because they want to see if you can figure out what's important and what's not important, right? Or they'll give you a sentence that supports answer choice A, a sentence that supports answer choice B, and so on and so forth. Well, at least that in that situation, you know there's a reason why they're doing it, right? So put yourself in the shoes of the test writer, because that's really gonna be helpful for you, I think, if you can do that. Another thing that I wanted to talk about is timing. I know that timing is a big issue for some people. I remember when I was tutoring people, they would often run out of time when it came to answering question blocks, 40 questions, whatever. It's tough, and the best advice I can give you is, if you got a lot of time in your hands, let's say you're 6 months out, take the time to answer questions untimed. Don't worry about finishing answering the question in a minute and a half. No, focus on understanding the question. If you're not a fast reader, I'm not a fast reader. Take the time to read questions carefully, because honestly, it's a reading comprehension test. Yes, it is testing you on medical knowledge, but outside of that, there's a lot of questions that you can get right just by reading the question and getting the hints from the question. Hints, what do I mean by that? Well, they're going to give you, like, giveaway things. There's always something. For example, I don't know, blue bloater, pink puffer for COPD. They're probably not going to do that anymore, because I'll tell you why. It's because they're steering away from those buzzwords. I would avoid trying to rote memorize buzzwords. Instead, what I would rather you do is understand the concept behind the buzzword. So if you know what a blue bloater is, then somebody explaining that concept in the question, they're not going to say blue bloater, but it's your responsibility to know, oh, they're describing a blue bloater here, right? Or, I don't know, any orphan eye nuclei. Go figure. That one's a tricky one, right? Yeah, there's a lot of buzzwords out there that you're going to be like, oh, what is that? What is this? And it's going to freak you out. All I can say is keep an open mind. Don't try to focus your mind on minutiae or factoids. Read the question, answer the question, and keep yourself a level head. I talked in the previous video about happiness and your state of mind. It's the same for this part as well. And for all I know, there might be a third part the more I think about things as they go forward. But I do hope you enjoyed this video. I went a little bit overboard, a little bit over time here. But please, if you have any questions, feel free to ask. And don't forget to comment, like, and subscribe.